Ambisome Vial is a medication used to treat serious fungal infections in patients who cannot tolerate or do not respond to regular amphotericin treatment. It works by stopping the growth of fungi. The dosage and timing of this medication should be determined by your doctor based on your medical condition and response to treatment. When using Ambisome Vial, it is typically administered through a vein injection once a day, as prescribed by your doctor. The injection should be given slowly over a period of 2 hours. The dosage will be determined based on your medical condition, weight, and how you respond to the treatment. If you are administering this medication at home, it's important to learn the proper preparation and usage instructions from your healthcare provider. Before using the medication, be sure to visually inspect the product for any particles or discoloration. If you see any, do not use the liquid. It's also crucial to learn how to store and dispose of medical supplies safely. In some cases, it may be necessary to continue using this medication for several weeks to several months in order to effectively treat certain infections. It's important to not stop the medication too early, as this may result in a return of the infection. If your condition persists or worsens, be sure to inform your doctor. Some people may experience fever, shaking, chills, flushing, loss of appetite, dizziness, nausea, vomiting, headache, shortness of breath, or fast breathing 1 to 2 hours after the infusion is started. In some cases, other medications may be necessary to prevent or relieve these side effects. If any of these effects last or get worse, tell your doctor or pharmacist promptly. This medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Tell your doctor right away if you have any serious side effects, including swelling or pain at the injection site, muscle or joint pain, unusual tiredness, weakness, muscle cramping, signs of kidney problems, numbness or tingling of arms or legs, vision changes, hearing changes, dark urine, severe stomach or abdominal pain, yellowing eyes or skin, swelling ankles or feet, fast, slow, or irregular heartbeat, cold sweats, blue lips, easy bruising or bleeding, other signs of infection, mental or mood changes, seizures, black stools, or vomit that looks like coffee grounds. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching or swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. Before using Ambisome Vial, make sure to inform your doctor or pharmacist if you have any allergies or if you are allergic to any of its ingredients. It's important to also share your medical history, especially if you have had white blood cell transfusions, heart disease, liver disease, or kidney disease. If you are planning to have surgery, it's crucial to let your doctor or dentist know about all the medications and herbal products you are currently using. If you are pregnant, Ambisome Vial should only be used if it is absolutely necessary. It's important to discuss the potential risks and benefits with your doctor. It is not known whether this medication passes into breast milk, so it's advised to consult with your doctor before breastfeeding while using Ambisome Vial. It's important to be aware that Ambisome Vial may interact with other medications, which can affect how they work and increase the risk of serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Ambisome Vial include anti-cancer drugs, azole antifungals, cidofovir, digoxin, flucytosine, medications that affect the kidneys, muscle relaxants, and zidovudine. Additionally, this medication may interfere with certain lab tests, potentially causing false results. It's important to inform lab personnel and all your doctors that you are taking Ambisome Vial. If someone has taken too much Ambisome Vial and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek medical help immediately. In the U.S., you can call the local Poison Control Center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Make sure to schedule regular medical tests while using Ambisome Vial, such as kidney/liver function tests, potassium/magnesium level checks, and complete blood counts. It's important to keep all of your medical and lab appointments. If you have any questions or need more information, consult your doctor. Be sure to take Ambisome Vial exactly as prescribed by your doctor. If you happen to miss a dose, consult your doctor or pharmacist for a new dosing schedule. Do not take a double dose to make up for a missed one. Be sure to follow the storage instructions provided with the product and consult your pharmacist for any specific details. It's important to keep all medications out of reach of children and pets. When it comes to getting rid of this medication, it's important to not flush it down the toilet or pour it into a drain unless specifically directed to do so. Make sure to properly dispose of this product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.